Hello, viewers. Welcome to another episode of The Cure for Your HIV. I remain your delightsome Mariam Moses, and I'm very passionate about your health, especially if you are a positive HIV patient, and also if you're not, because I want you to stay very much healthy. All right. So today I welcome you to another episode of The Cure for Your HIV. Follow me on this channel so you can learn how to live, without HIV on this channel, and if you are positive, how you should attain almost a negative result of viral load count on this channel. Now you have to stay tuned on this channel. Don't forget, click on the subscription button, and then click on the notification bell as well, so as to get updated when another episode is released. All right. So if you are looking for testing, you want to know your status, you want to know where you stand for, or if if you want more information on other sexually transmitted infections and prevention, or maybe you'd like to know some honest truth, or advice, or what to do about your relationship. Okay, probably your partner is positive, you're negative, you're worried on how to go about it, what will become your children, what will be of your children, or what is going to be the outcome of your children. How are you going to do it for you to give birth to negative children and to stay, to have a successful viral load suppression so as not to, infect your partner? What do you do actually? If you are looking for all of this, you will find them right there in this channel. I am 100% available for you. You can chat me up on the chat box, or you can reach me on my email and I will give you response. Peradventure you want to be private, you don't want to come public, then my phone number is on the channel, so just get across me and we will discuss. Okay, all right. I love you, and I want you to stay healthy. I want you to ensure that the people around you are as well as healthy as you are, within the possible grace you would have. And trust me, you are going to have the life of your dream, because I want you also to live life on your terms. I want you to fulfill your dreams and goals and ambition to live normally like every other person. So I love you so much. All right, so today we're going to be talking about 8 signs and symptoms, of course in male and female, but today I'm going to be talking about the ones in male particularly. So if you have a male or a man and you're worried, how do I know if I have this HIV and AIDS we're talking about? Okay, so in men, initially HIV symptoms are typically unspecific. All right, so early symptoms are usually bearable and frequently mistaken for flu. Okay, so then another mild condition may also occur, and this can be underestimated or mistaken for minor health conditions. Okay, so of course we know this is due to the fact that the CD40 cells of the body, which is the strength or the immune system key infection fighters, tends to are weakened by this virus, and as a result other infections can just swim in into the body of their host. Okay, so men can experience flu-like symptoms some days to weeks after contacting the virus, and this includes they could have things like fever, they could have skin rash, they could have headache, a sore throat, and even tiredness. Okay, so here I'll talk about general signs and symptoms of HIV in both male and female now. Okay, so we have diarrhea. Okay, so it's common for the both sex. Then we have dry cough, memory loss, depression, neurological disorder, pneumonia, unexplained fatigue. All these can be seen in the both sex. Rapid weight loss, recurring fever or profuse night sweat, swollen nerves, glands and armpit, the groins or the neck, and so on and so forth. Mouth ulcer or mouth thrush. All these are general symptoms in the male and the female. Okay, so like I said earlier, I said men can experience flu-like symptoms. Of course, some symptoms that will make you to think, oh, this is normal. Don't think it's normal. Go to the hospital and get yourself tested. All right, so I'd mentioned them earlier. You have the skin rash, you have the fever, you could have headache, you could have sore throat and tiredness, especially when you know that you're a very, very sexually active man. All right, so I'll be talking about some other symptoms apart from the the flu. Okay, so some men may also experience severe symptoms, of course, apart from this flu. And some of these symptoms include dementia. They could have weight loss. I said that earlier. The man can have fatigue and ulcer. They can have ulcer and genital swelling, ulcer also on their genitals. They could have sore muscles, pain, nausea, vomiting, and so on and so forth. These are the common symptoms a man can have if peradventure it happens to be positive. Okay, all right, so let's quickly move to the next slide. The next slide here is a picture showing some people who have been diagnosed positive for HIV, and then they are showing the symptoms of skin rashes here, skin infections. You see you have psoriasis, pathogenesis, and then you have mycoplasma pneumonia, the Stevens-Johnson syndromes. Okay, so you see the blood split from the penis, mouth sore or ulcer, and then you have the skin rash there. All right, so we have the non-AIDS defining cancer as well. So some men could have penile cancer, anal cancer as well, and all this is very important. With all what I'm trying to say here is that it is very important for you to go to the hospital and be tested, especially when you discover this kind of some of these symptoms in your body. All right, so you should go to the hospital and get tested. All right, okay, so we have HIV diagnosis in men and female. All right, so but usually the both sex have what we call the antibodies. All right, so and of course this test can be done in the lab, so for you to check. And here you could see some pictures also of the groins and part of the body being affected. Okay, how often should a man get tested for HIV? How often should a man get tested for HIV? So most men really are sexually active, and if you are in that category, you should at least get tested once in your in their lifetime. But then I will say you should get tested, especially routinely. You could have that at least once in a year. At least once in a year. If you love your health very well, so much you can make it twice in a year. Go get tested and know what your status is like. Okay, so of course CDC recommended that everyone between the age of 13 and 64 should take an HIV test, so which is very, very important. All right. So beside this formal recommendation, everyone who may have been exposed to HIV or had sex without a condom should also take a test. So that is an advice. Okay, so you should go take a test. All right. In a man, we have this picture shows early symptoms of HIV. Look at it very closely. You have fever, chill, you have headache and mood swing, and so on and so forth. And sometimes you could think, this is normal, I don't think I have any challenge. So please, when you have this, don't forget, also go for your HIV test, and do not have any stigma. There is nothing there. You're just going to know, you want to go to know to know your status. That's why you're going there. You're not going there for anybody. Your life, it's very important to you. That's why you are going for HIV testing, for you to know your status, because it is better you know it than for you not to know it. All right, so I will be stopping here, and next time we will be talking about the early signs and symptoms of HIV in women. All right, so if you like my video, give me a thumbs up. Also subscribe to this YouTube channel and click on the notification bell so as to get updated when new episode of the Cure for Your HIV is released. However, thank you for staying tuned. Thank you for watching, and see you in my next video. But then, if you want to, you can visit my channel to explore, various teachings as well. You can chat me, or email me. My email address is there on the channel. If you want to explore some various teachings as well as resources on HIV and AIDS, of course. And then if you want to know how to keep yourself healthy, whether you're living with HIV or not, and also the people around you, you can always reach out to me via my mail, or chat me, or drop a message on the chat box or the comment box. I will respond to your message. See you in my next video. Do have a wonderful day. Take care of your health. Stay COVID free. I love you so much, and bye.